This will be a clean dressing change video for Nursing 112 at Belleville State Community College. I'm Brooke Swindle and I will be performing the clean dressing change today. So before I even enter the patient's room, I will check the physician's orders and see that it is a clean dressing change. For the site, the abdominal site, the dressing is to be changed once daily, the order says. And so I will gather up my supplies and I will go to enter the patient's room and I will knock. The patient will say, "Come in," and as I walk in with my supplies, I will do hand hygiene, and I will introduce myself to the patient. So I'll say, "Hi, my name is Brooke Swindle. I'm a Belleville State nursing student. I'll be assisting your RN today to help with your clean dressing change on your abdomen. Can I see your armband, please? And can you tell me your name and date of birth?" The patient will verify their two identifiers. They will be correct. I'll ask them, "Have you had a clean dressing change before?" They will say, "Yes, it was changed yesterday." I will say, "Are you okay with us changing it again today?" And they will say, "Yes, I'm okay with that." So I will clean the bedside table. I'll wipe it down, the top and the edges. And while that's drying, I will set up my biohazard bag and I will turn it inside out so I can easily put stuff in it. I will set it at the foot of the patient's bed. And now that I've got that set up, the table is now dry. So I will lay my cloth on, protective cloth on it, just symbolize that the table is clean. And then I will set up my station. So I will get my paper tape, I'll get my gauze, and the way I'll open the gauze is I will grab a corner, open backwards, put it under, and sit it down. And I'll do that same thing with my second pack of gauze. Then I will get my saline solution. I will check that it's the right solution and that the date is still good. I'll sit that down. And now that I've got my station set up, I'm gonna hand hygiene again. And I will put on some gloves. And while I'm putting on my gloves, I'll ask the patient if they have any allergies, if they're in any pain, if they need to go to the bathroom before we begin. And I'll just talk to them while I'm also finishing putting on my gloves. I'll just talk to them and see how they are, if there's anything they are going to need after this, or if there's anything they want. Now that I've got my gloves on, I will fold down and uncover them, but make sure they're still covered as much as need to be. So I'll uncover the patient and see the wound dressing. And now I will remove this wound dressing, and I will remove it by rolling up the edges towards the center while being aware of the patient and making sure they're comfortable and that they're okay with everything I'm doing. And then I will roll it towards the center and lift it up towards me to look. I will be looking for coach. I will look at the color. I'll look for odor, amount, the consistency, and how the patient tolerated it. Once I look at it, I will drop it in the disposable bag. And now I will remove these gloves. Now I will put those in the disposable bag. Now that I've removed my gloves, I would hand hygiene again. And while I'm hand hygiening and putting on some new gloves, I will look at the patient's wound or incision site. I'll be looking for Rita. I'll be looking for redness, edema, any bruising, if they have any drainage, and the length of the wound and all that. I'll also look at their staples or stitches, whichever they have, and make sure that they are intact. If there is a drainage site, I will also look at that at this time. I'll look at it to see what color drainage, how much it's draining. And again, while I'm reapplying gauze after looking at the wound, I will talk to the patient, see how they are at this point, see if they're still okay. And now that I've got my second pair of gloves on, I will take my saline solution. I would uncap it and set the cap turned upside, where it's facing up. I would do something called lipping my solution, which is where I would pour a small amount into the biohazard bag, and as I pour it, I would turn the bottle. And once I do that, I would come back over and wet some of my gauze. And now I'm ready to clean the patient's dressing. So So I would pick up one gauze, like a little wonton, without touching the underside. And with this gauze, I would start at the top and wipe down. I would discard of it. I'd get a new one, and make another little wonton. Now for this one, I would not reach over. I'm going to do the away. So I'm going to reach around and wipe from top to bottom and discard. And then again, I'd get another one, get one more, and do the close side, which is closer to me, and do top to bottom and discard. And if I needed to, I could repeat this step if there was more drainage or excess drainage. And now I'm going to grab a dry one, and I'm going to pat the incision dry. I'm not going to rub it. And now that I've dried it, I'm going to put some new gauze over it for the new covering. Put my new gauze. As long as I don't touch the underside of the gauze, it's okay. And I'm going to do 2 layers to ensure that it is nicely sealed, and that there will be no leakage or anything that can get in. And now that I've got that on it, I'm going to take off my gloves. I will again dispose of them in the bag. I would again hand hygiene. And now I'm going to do something called window pane taping. So I would tear off a piece of my tape. I'd cover the top. I'd tear off another piece of tape and do the bottom. And now I'm going to do both sides, making sure they overlap and that it's exclusive so nothing can get in or come out of this wound. And now, since I didn't use a combine pad, I just used 4x4s. I'm going to put a piece across the middle where they overlap so that nothing can get in. And now that I've done that, I will grab my pen, and I would take a small piece of tape, and on the bedside table, I would put my initials, the time, and the date. And once I write all that on there, I would take the piece of tape and I would put it somewhere on the wound dressing. And then I would cover back up the patient and make sure that they are comfortable, that they are safe, and that they have everything they need. And then I would, according to my facility's policies, get rid of the biohazard bag. I would clean up the rest of the station. I would hand hygiene. I would leave the room, and then I would document everything that I did and all the results.